Welcome to your clinic. Today you are here for a pre-surgical consultation with your anesthesiologist. Prior to this meeting, you received an information sheet that describes various anesthesia procedures. This sheet also includes explanations of the side effects and complications associated with these procedures. To start our conversation, I would like to ask you a few questions about your medical history. Let's begin. How tall are you in centimeters? How much do you weigh in kilograms? Do you have any allergies? If you are a woman and have given birth to children, did your deliveries go smoothly? Did you have an epidural anesthesia during a natural childbirth? Or did you have general anesthesia or spinal anesthesia during a cesarean section? Now about previous operations and anesthesia. Have you ever had an operation? If so, have you had general anesthesia? Or have you had local or regional anesthesia? Were there any complications during operations or anesthesia? If yes, then what kind of complications? Let's now come to the chronic illnesses. Do you have any illness of the cardiovascular system or the lungs? Do you have any illness of the gastrointestinal tract, the liver, or the kidneys? Do you have neurological disease of the brain or spinal cord? Do you suffer from diabetes or thyroid dysfunction? Do you have other diseases that we haven't talked about yet? Is there anyone in your family with a muscular dystrophy? This is a congenital muscle disease that is very rare. Now it's about medication. Do you take any medication regularly? Do you take aspirin or other anticoagulant medication, such as abdominal injections to prevent thrombosis? Have you ever had a thrombosis? Do you have major back problems or even herniated discs with movement and sensory disorders in your legs? Do you smoke? Are you taking illegal substances? Now, we have finished the health questions. Next, I will explain to you the common anesthesia procedures. Basically, the following applies. For a planned operation, you should not eat anything, drink anything, or smoke in the 6 hours before the procedure. After preparation in the ward on the morning of the operation, you will be accompanied to the operating room. There, we will provide you with an infusion access, through which we can give you fluids and medication during the procedure. If you get general anesthesia, then we inject a medication through the infusion access, which will put you to sleep. You will be monitored and ventilated during surgery, but you won't notice anything. If you receive spinal anesthesia, then, in a sitting position, after local anesthesia on the lower back, a very thin needle that you can hardly feel is giving a medication into your spine. Therefrom, a feeling of warmth rises from the feet and your lower body is then insensitive to the surgical stimulus. During the course of the spinal anesthesia, we can, if you wish, give you a sedative, which will make you calm or even fall asleep. If you have an operation on your arm or leg, your anesthetist can, in many cases, achieve targeted anesthesia of the surgical area by specifically injecting local anesthetics near to peripheral nerves. After the operation, you will stay in our recovery room. There we will monitor your vital parameters and pay attention to side effects and possible complications from surgery or anesthesia. You will receive pain therapy, anti-nausea medication, and we monitor, for example, for possible allergic reactions or bleeding complications. After your stay in the recovery room, you are taken back to your room and stay there until you have entirely recovered. Do you have any questions? For more detailed information, We refer you to the information brochure that you received before our conversation, and which we will then sign together. Thank you for your attention and goodbye.